Government says a task team has been established to reassure investors and trading partners in the red meat industry over the outbreak of foot and mouth disease. The outbreak in Limpopo stopped the export of products from cloven hoof animals such as cattle, pig and goats. Namibia, Botswana and the Kingdom of e-Swatini, formerly Swaziland, have suspended meat imports. Wessel Lemmer, who's a senior agriculture economist at ABSA Agribusiness, joins me in studio for more. Thanks so much for your time on SABC News. Let's speak about this foot and mouth disease. What is it and how has it affected the production of meat products in South Africa?
No, thank you for having me. I think what is very important is that we see why did we get suspended from exports. And the focus here is that countries that import meat from South Africa are very concerned about their animal production gets impacted in their countries. Now, so foot and mouth disease is a viral disease and it impacts the productivity of cattle, feedlots, like pigs and so forth, and beef cattle. So what is important is that, and to take into consideration that there's very strict regulations throughout the world and South Africa adhere to that. So there's only 2 cattle in the foot and mouth disease free area that was detected, and there's very good collaboration between our government and the private sector to monitor those areas to make sure it's foot and mouth disease free. So there's a number of cattle that's in quarantine, and it's in the northern parts of Limpopo. So it's not widespread throughout South Africa. And the impact will be on the productivity of cattle, and that's why it's a serious for countries where we export to. So having this, our foot and mouth disease free status being suspended, how long will that take to be reinstated? It can take up to a year or 2. So it's unfortunate on the one hand, because we export about 3% of our beef to other countries in the world. So what must happen now? In general, we have our foot and mouth disease free status being suspended. So this will be a negotiation between country to country now to see if they will still accept South African beef. And that's a possibility if they're not concerned, say for instance a country that don't have a big production of their own cattle, they can still say, listen, but we are willing to still import beef from South Africa.
Okay, we spend about $145 million on the meat that we export. If there's confusion or there's a suspension of that foot and mouth disease free status and we can't export freely now, how's that going to affect us in South Africa and the price of our meat here?
Well, at the moment we normally see in January a seasonal decline after the festive season in prices. Now with this foot and mouth disease coming through is what we expect that 3% of the beef that we export come into our local market, and that will increase the supply and it will have an impact on our prices locally. So on the one hand it's good news for consumers that prices will be a little bit lower. I don't expect there will be a big decline in prices because the demand for protein in South Africa is large. We don't expect huge increases in prices. Our consumers are under pressure. So I think lower prices will actually increase the demand for local meat and also those exported meat that will be referred back into our local market. So for the consumer, in the short term, it's actually good. It's good news, but I think I don't think it will be long-lived because we have such a demand for beef. But let the consumer take the opportunity and buy some meat and let's go on.
Okay. We know that there's a task team that's been set up to try and mitigate this fallout from this foot and mouth disease. Talk to us a little bit more about that collaboration you spoke about between the private sector and government and how much lobbying is being done perhaps to these countries to say, you know, South Africa, there's just 2 cows that had that disease and our meat is still okay. Yeah,
so the collaboration between the Department of Agriculture and the private sector, the beef sector and piggeries, actually the total meat sector, through the National Animal Health Forum is very good. So, and also to contain those animals that's affected and to monitor those areas. So the collaboration is very good. And we also see that For the medium term, we have about 400 million that's dedicated by government actually to increase our biosecurity in terms of the production of vaccines. So, and that government's trying to help us to help the industry to get that, to get it earlier available, maybe in the next year, so that we already can start this year or the following 18-24 months to get that capacity up and running and to get to be prepared better in terms of vaccines.
Thanks so much for your time. Senior Agricultural Economist at ABSA, Wessel Lemmer, joining us in studio, speaking about that foot and mouth disease.